I've seen people throw doctors online a lot, saying a lot of doctors nowadays use Google to make diagnoses and to treat patients, and that is very not and that's not good, and that it shows incompetence on the side of the doctor. I don't think that's the case. I mean, personally, 2 years ago, I designed a website where I compiled a lot of links. So links I commonly reference, to confirm things. I put them all together on a web page, and there are many other doctors that do this. We always reference guidelines, really nice guidelines, BMA guidelines or BMJ. We want to make sure that we're doing the right thing. Now, when it comes to any particular health condition, there are so many options of treatment, but we want to make sure that we're following the guidelines just so that if by any chance things go wrong, maybe the patient has side effects to medications or complications to any procedure or medications we've prescribed, then you are kind of defended, or you're protected rather, in case of problems. Because if you have not followed the guideline, then if problems arise, then people will ask you, why didn't you follow the guideline? The guideline says you should try this particular medication as first line before you try this other one. If you go and try the one that is second line or third line and the patient has a complication, you have not tried the first line medication, for instance, then you could go into trouble. So it's more like we want to confirm that we're following the guidelines, more like to protect both the patient and to protect ourselves. You'll be surprised that even simple things like prescribing the dose of antibiotics, sometimes you just be like, so that's always be writing, you be trying to trimethoprim or nitrofurantoin, very simple things, but sometimes you will just have that brain glitch. You're like, just double check this, and then I go into the BNF, the national, drug formulary, and just confirm. I'm like, oh yeah, I thought as much. It's more like for safety of our patients and for us. At the same time, we doctors are not gods. We're human beings. We do forget things. So if I see a case, or if a doctor sees a case that they've probably not seen in many years, I mean, they've read about it, they have the theoretical knowledge, but they've probably not seen this case in many years. What happens to knowledge that you don't use? That not any knowledge you don't use goes to a very much lower layer in your brain or your mind. And knowledge that you use most of the time, simple things, cough, catarrh, chest pain, things you encounter on a day-to-day basis, the knowledge is higher up, in your mind. So if, for instance, last month or within the last 2 months, I saw a patient who came with winging of the scapula. I said, oh, they felt that their scapula was winging, which means it was protruding, the shoulder blade. And I've never seen a patient with wing scapula, but obviously I read it in my second, third year in school, which is over 10 years ago, you know what I mean? And I know it's serratus anterior muscle damage to lung thoracic nerve. But at that point in time, that knowledge was like very remote in my mind. And I was like, I just needed to remind myself. And the patient was there. I explained that, okay, that, it could be a nerve damage. I think it's lung thoracic nerve, but it's something I read over 10 years ago. And right in the patient's presence, I went on Google and typed in lung thoracic nerve, wing scapula, and it confirmed that it's lung thoracic nerve, damage to serratus anterior, even though the patient didn't have any objective evidence of that. But I discussed that with the patient. And now the difference, what makes us doctors is that even when we go on Google or do a quick Google search and extract that information, because we are trained, because this is knowledge that we've known before, probably has become remote because we've not been using it, that particular knowledge, we're able to understand how to apply that knowledge, and we share that information with our patient. If I do a quick Google search, the patient is there, I discuss it with them, I interpret that knowledge with them. And I see a lot of patients appreciate the fact that, yes, you're vulnerable enough to admit that, you've probably forgotten some things. You're human being, you're human, and the human brain will naturally forget anything that it doesn't commonly use, any information. And we discuss that. And patients, for me, from my own experience, a lot of my patients appreciate that. But coming online, I see that there's a lot of troll. Um, People say doctors are incompetent. I don't think that's actually right.